So drain-free tummy tucks are great options for patients too. They're just different, and it just depends on what type of complications you're willing to risk. So when we do a tummy tuck, we lift the abdominal wall up off of the muscle layer from the hip bones all the way up to your rib bones. And so you have a big raw surface area that weeps fluid. So in general, you kind of have one of two options. You could put drains in that will stand for 5 to 7 days for most patients and will drain that fluid away, and then they pull out. They don't really hurt when they come out, but they are a nuisance to have to deal with them. Or you can do something called progressive tension sutures, where you stitch the abdominal wall back down to the muscle layer. And so the problem with doing that method is that sometimes you still have too much fluid to handle, and you can get pockets of fluid called seromas. But also in thin patients, sometimes you can actually see the little indentations where the stitches are. So there's no right or wrong method, just whatever your surgeon's comfortable with. Some surgeons like to use the progressive tension sutures to kind of make lines at the edge of the abs and make it appear as though you have, like, you know, the edge of your muscles there, and it looks really nice in the right patient. So it just depends on what you're looking for and what your surgeon's comfortable with. But they're both great options. Neither one is better than the other. They're just different.